Here's something most people never realize. Doctors don't just rely on lab tests, scans, or blood work to know when something's wrong. In fact, within the first few moments of seeing you, before you've even said a word, a trained physician can often spot hidden health issues. How? By simply noticing the way you care for yourself. Think about it. The way you brush your teeth, the state of your skin, how your hair looks, even your nails and the clothes you wear. These aren't just cosmetic details, they're powerful signals. Signals that can reveal whether your body is fighting an illness, whether you're struggling with energy, memory, or mobility, or even whether you might be slipping into depression without realizing it. Most of us grew up believing personal hygiene is only about looking clean, smelling fresh, or making a good impression. But to doctors, hygiene is something far deeper. It's like a secret window into your overall health, your independence, and even your future well-being. And here's the truth no one really talks about. For seniors, especially those over 60, these signals become even louder. Why? Because the smallest changes in daily hygiene often point to bigger shifts in your health. It might mean your hands are too stiff from arthritis to brush properly. It might mean fatigue is keeping you from showering. Or it might mean memory lapses are quietly disrupting your daily routine. I know this may sound a little unsettling, but here's the good news. Once you understand what these hygiene mistakes are, you gain power. Power to take control, to catch problems early, and to protect not only your health, but also your dignity and independence. In today's video, I'm going to walk you through 7 hygiene mistakes that doctors instantly notice. These are not judgments, they're clues. And every single one of them can be corrected, often with simple, practical steps that restore confidence, energy, and self-respect. I especially want you to stay tuned until the very end because the last mistake is one that almost no one talks about, yet it can completely change the way your doctor and even your loved ones see your health. So whether you're watching this for yourself or for a parent, grandparent, or loved one, I encourage you to pay close attention. Some of what you're about to hear may surprise you. Some of it may even hit close to home. But every insight you take away today can make a difference in how you age and how you live. Ready? Let's begin. The very first place most doctors look when they want to understand your overall health isn't your heart, your lungs, or even your blood pressure. It's your mouth. Within seconds of a simple smile or an open mouth exam, a physician can spot powerful signs of how well or how poorly your body is coping. Bad breath, bleeding gums, loose teeth, or buildup of plaque and tartar are more than just cosmetic concerns. They're silent alarms. And for seniors, these alarms ring louder than ever. Why doctors notice it instantly? When a doctor sees neglected oral hygiene, it immediately raises questions. Is this person struggling with arthritis or hand pain that makes brushing difficult? Have they lost the energy or motivation to maintain daily self-care? Is memory loss beginning to interfere with routine habits? Even a short conversation can reveal hidden issues. For example, dry mouth, something a doctor may notice just from speaking with you, can be a sign of medication side effects, dehydration, or early diabetes. The hidden health risks. Here's what most people don't realize. Your mouth is directly connected to the rest of your body. Every time you swallow, eat, or even breathe, bacteria from your gums and teeth can enter your bloodstream. And once there, they can trigger inflammation in your arteries, weaken your immune system, and even increase your risk for heart disease, stroke, and dementia. Studies have shown that seniors with gum disease are more likely to experience worsening diabetes. Poor oral health can also make chewing painful, leading to poor nutrition, weight loss, and in some cases, dangerous frailty. Doctors know this, which is why they immediately pay attention to your oral hygiene. To them, your mouth isn't just about teeth. It's a window into your entire body's well-being. Take the story of Tom, age 77. After moving across town, he stopped visiting his dentist. At first, he didn't think it mattered. After all, he still had most of his teeth, and brushing once a day felt good enough. But over time, his daughter noticed he was eating less. Meals that used to bring him joy became a struggle. When Tom finally went for a routine checkup, his doctor immediately noticed a strong odor on his breath and gum inflammation. That small observation led to a deeper conversation. It turned out Tom had been skipping meals because chewing was painful. He'd started losing weight, feeling more tired, and avoiding social gatherings out of embarrassment. With encouragement, Tom returned to daily brushing, had his dentures properly cleaned and adjusted, and scheduled regular dental visits. Within weeks, his appetite returned, his energy improved, and perhaps most importantly, he began smiling again in family photos. Neglecting oral hygiene is rarely about laziness. More often, it's about something deeper: fatigue, low mood, physical pain, or even subtle memory decline. To doctors, it can be a red flag of depression or cognitive change. When someone who once cared about their appearance suddenly stops brushing or cleaning dentures, it often signals that they may need emotional or medical support. The good news: this is one area of health where small, consistent actions can make a huge difference. Brush at least twice a day with a soft bristled toothbrush. If flossing feels too difficult, try interdental brushes or water flossers. Clean dentures daily. Never let them sit unwashed overnight. Visit a dentist at least once or twice a year, even if you have full dentures. If arthritis or hand stiffness makes brushing hard, use adaptive toothbrushes with larger grips or electric brushes designed for seniors. Doctors know instantly when oral hygiene is being overlooked, not because they're judging you, but because it's one of the clearest reflections of your overall health. Taking just 5 minutes in the morning and 5 minutes at night can protect not only your teeth and gums, but also your heart, your brain, and your independence. In other words, caring for your mouth isn't just about fresh breath. It's about staying strong, connected, and confident for years to come. Your skin is your body's largest organ. It covers you head to toe, protects you from infection, regulates temperature, and even communicates what's happening inside your body. To a doctor, your skin is like an open book. Every spot, every bruise, every sore, it tells a story. And often, those stories reveal problems long before blood tests or scans do. Unlike other organs, your skin is visible everywhere. That means any sign of dryness, redness, flakiness, unusual rashes, or slow-healing wounds is instantly noticeable. Doctors are trained to spot dry, cracked patches, often a sign of dehydration, poor nutrition, or vitamin deficiencies. Bruises, which may hint at fragile blood vessels, clotting problems, or even medication side effects like blood thinners. A skin discoloration, which can point to circulation issues, diabetes, or liver problems. Bed sores or ulcers, often the clearest warning of immobility, frailty, or poor self-care. These aren't just surface problems. They're red flags about your deeper health and independence. Dry or flaky skin may seem harmless, but over time it creates tiny cracks that allow bacteria to enter, raising the risk of infections. Skin that bruises too easily can point toward vascular disease or nutritional deficiencies. Slow-healing wounds, especially on the legs and feet, often warn of diabetes or poor circulation. issues that can become life-threatening if ignored. Pressure sores, commonly seen on the back, hips, or heels of those who sit or lie down too long, are particularly dangerous. They don't just cause pain. They can spiral into infections, hospital stays, and serious declines in independence. Doctors know that if someone has untreated sores, it often means they're struggling at home, perhaps sitting too long, unable to move easily, or even too discouraged to care for themselves. Let me tell you about Virginia, age 82. She always wore long sleeves, even in summer. At her doctor's appointment, she brushed off questions about her health, saying she felt fine. But when her doctor gently asked to look at her legs, he discovered dry, cracked skin and patches that weren't healing. Further tests revealed undiagnosed diabetes, a condition that had been silently creeping up for years. That simple observation, something Virginia herself ignored, changed everything. With treatment and better skincare, her energy and overall health improved. And she later admitted, "I thought dry skin was just part of getting older. I didn't know it was my body's way of asking for help." Here's something important. Ignoring skincare isn't just about physical decline. It's often tied to emotional well-being. When people feel lonely, overwhelmed, or depressed, they may stop paying attention to their appearance. They skip lotion, overlook new bruises, or dismiss sores as not important. But doctors notice right away. Neglecting your skin can be one of the first signs of declining motivation or hidden depression. The good news is that protecting your skin doesn't require fancy treatments or expensive products. Inspect daily. Look at your arms, legs, feet, and back if possible. If you can't check yourself, ask a loved one to help. Use a gentle, fragrance-free lotion every day, especially after bathing, to lock in moisture. Stay hydrated. Drink water consistently. Dehydration shows up first in your skin. Be gentle. Use soft washcloths. Avoid harsh scrubbing, and pat skin dry rather than rubbing. Stay clean and dry, especially in skin folds, under breasts, or between toes, where moisture can cause fungal infections. Act quickly. If you notice a sore that doesn't heal, a bruise that appears without reason, or sudden changes in skin color, don't wait. Call your doctor. Your skin isn't just your outer shell. It's a messenger. When cared for, it protects you, keeps you comfortable, and helps you age with dignity. When ignored, it sends warning signs doctors can't overlook. Paying attention to your skin isn't vanity. It's survival. Because sometimes a small patch of dryness or a bruise is the first clue to something much bigger happening inside your body. Hair may seem like a small detail, but for doctors and for health overall, it says a lot. Matted, oily, flaky, or unkempt hair is visually obvious the moment you walk in the room. A doctor doesn't need tests or scans to see it. And more importantly, your hair and scalp often reveal struggles you may not even realize are affecting your health. During a physical exam, a doctor will often part your hair or glance at your scalp, and what they see can be surprisingly revealing. Oily, unwashed hair may signal that showering or bathing has become difficult, often due to mobility issues, pain, or even depression. A matted hair, especially in the back, can suggest long periods of lying down, fatigue, or difficulty with self-care. Flakes or dandruff might point to fungal infections, overly dry skin, or poor scalp hygiene. Sores, lesions, or bumps are sometimes linked to skin cancers, infections, or autoimmune conditions. Thinning or brittle hair can be tied to nutritional deficiencies, thyroid disease, or side effects of certain medications. To a doctor, hair isn't just about grooming. It's another diagnostic window into overall health, energy, and independence. The hidden risks of ignoring hair and scalp hygiene. Neglecting hair care can set off a ripple effect. Infections. A dirty scalp can harbor bacteria or fungus, leading to itching, sores, or even cellulitis. Infestations. Lice or mites, though often associated with children, can affect seniors too, especially in assisted living environments. Self-neglect signals. Doctors know that when hair hygiene slips, it often points to a larger issue. Perhaps someone is skipping meals, missing medications, or withdrawing socially. Nutritional red flags. Dry, brittle hair or sudden hair loss may be an early warning of protein, iron, or vitamin deficiencies. For seniors, these aren't minor inconveniences. They're signs that daily routines are breaking down, and that independence may be at risk. Take Harold, age 79. He lived alone after his wife passed away. His daughter began noticing his once thick hair looked greasy and matted in the back. She thought it was just aging, but when Harold went to a doctor, his scalp showed patches of fungal infection. The truth? Harold had arthritis so severe, he couldn't lift his arms long enough to wash his hair properly. Too embarrassed to admit it, he simply let it go. The infection spread, and he started withdrawing socially because he didn't want anyone to see. With a little help, switching to a no-rinse shampoo, using a long-handled scalp brush, and getting occasional assistance, Harold regained his confidence. His daughter later said, "It wasn't about the hair. Hair is deeply tied to identity and self-respect. When someone stops caring for their hair, it often reflects more than physical limitations. It can reveal loneliness, grief, or depression." Doctors know that when a senior arrives with unkempt hair, it may not just be about hygiene. It may be a silent call for help. And here's the powerful truth. Restoring something as simple as clean brushed hair can bring back confidence, joy, and social connection. Seniors often say they feel like themselves again once their hair is cared for. The good news is that hair and scalp hygiene can be simplified, even if full showers aren't easy anymore. Use mild shampoo. Choose gentle, fragrance-free options designed for sensitive scalps. Try no-rinse alternatives. Dry shampoo sprays or rinse-free foams are lifesavers for those who struggle with bathing. Brush daily. Even a soft bristle brush helps keep oils distributed and prevents matting. Adaptive tools, long-handled brushes and sponge sticks make it easier for those with arthritis or limited mobility. Professional help. Visiting a salon, even just for a wash, can boost hygiene and mood. Routine checks. Ask family or caregivers to look for sores, dandruff, or scalp irritation. Your hair may seem small in the grand picture of health, but it's often the first detail others notice, and the first clue doctors pick up on. Clean, cared-for hair doesn't just protect your scalp, it protects your dignity. Because when hair hygiene slips, it's rarely just about hair. It's about mobility, mental health, and independence. And when hair is restored, it often restores so much more. Confidence, connection, and pride. Of all the areas of the body that reveal health, the feet might be the most telling, and the most neglected. While we often focus on hair, skin, or teeth, doctors know that simply removing your shoes can uncover powerful clues about your health, mobility, and independence. Untrimmed nails, fungal infections, dry cracked heels, foot odor, or skin breakdown between the toes. These aren't just cosmetic issues. They're visible warnings, and to a trained eye, they can point to serious hidden problems. Why doctors pay special attention to the feet. During checkups, especially for seniors, physicians and nurses almost always look at the feet. Why? Because the feet are often the first place circulation issues, nerve damage, and infections show up. A thick, yellow, or fungal nails can signal poor immunity or difficulty reaching down to care for oneself. Untrimmed toenails may point to mobility limitations, arthritis, or vision problems. Cracked heels or dry skin can reveal dehydration, diabetes, or neglect in basic hygiene routines. Sores or wounds between toes can be signs of fungal infections, poor circulation, or uncontrolled blood sugar. Swelling, discoloration, or cold feet can point to vascular disease, heart failure, or neuropathy. To doctors, feet aren't just about walking, they're about circulation, nerve health, and even predicting long-term independence. The hidden dangers of poor foot hygiene. Neglecting foot and nail care isn't just uncomfortable, it can be dangerous. Infections spread quickly. Bacteria and fungus thrive in warm, moist areas. Left untreated, these can cause cellulitis or bone infections. Balance and mobility problems. Overgrown or painful toenails can make walking difficult, increasing fall risk. Serious complications for diabetics. Even a small blister can become a life-threatening wound, leading to ulcers or amputations. Circulation issues revealed. Poorly cared for feet often reflect underlying problems like peripheral artery disease or neuropathy. For seniors, especially those with diabetes or vascular disease, foot hygiene is not optional. It's a matter of health, safety, and survival. Eleanor, age 82, was proud of her independence. Harder because of arthritis. She ignored it, thinking it wasn't a big deal. At her annual exam, her doctor noticed a small sore on her heel, surrounded by dry, cracked skin. Eleanor brushed it off, saying it didn't hurt. But tests revealed she had poor circulation and early signs of diabetic neuropathy. What seemed like a minor crack was actually the start of a dangerous ulcer. With early intervention, daily foot care, and podiatry visits, Eleanor avoided what could have become a devastating infection, even amputation. Her doctor later said, "The feet tell the story of the whole body." The emotional side of neglected feet. Many seniors feel embarrassed about showing their feet. Thick nails, fungal infections, or odor can lead to shame or isolation. Some stop wearing sandals or going swimming, while others avoid doctor visits altogether out of fear of judgment. But here's the truth. Doctors don't judge, they investigate. If your feet are neglected, they don't see failure, they see clues. They see circulation problems, mobility struggles, or silent health risks. And by speaking up, you can prevent much bigger issues. The good news is that foot and nail hygiene can be managed with simple daily habits and a few adaptive tools. Wash daily. Gently clean feet with warm water and mild soap. Dry thoroughly, especially between the toes to prevent fungus. Moisturize heels, use lotion on dry, cracked areas, but avoid between toes to prevent infection. Trim nails straight across, not too short to prevent ingrown toenails. Inspect daily, check for blisters, cuts, redness, or color changes. Wear breathable socks, and change them daily to reduce moisture. Seek podiatry help. If you can't trim your nails safely, or if you notice persistent problems. Your feet carry you through life, but they also reveal your health story. For seniors, especially those living with diabetes or circulation problems, falls and avoidance. Many seniors actually skip showers out of fear of slipping in the bathroom. Ironically, avoiding bathing creates a cycle of poor hygiene, lowered health, and further isolation. George, 79, used to shower every morning like clockwork. But after a minor fall in his bathroom, he became hesitant. Even with a rubber mat, the memory of slipping stayed with him. Slowly, he began stretching showers further apart, first every 3 days, then once a week. When his doctor examined him, the dry, itchy patches on his back and the rash around his waistline were clear signs of skipped hygiene. But beyond the skin problems, his daughter admitted she noticed her father withdrawing from family gatherings. He didn't want people to get close enough to notice the smell. Once safety bars and a shower chair were installed, and with a little encouragement from his daughter, George began bathing regularly again. The change was more than physical. His confidence returned, his skin cleared up, and he felt comfortable socializing again. The psychological side of bathing. Bathing is tied deeply to dignity. When someone stops washing, it often reflects more than just physical limitations. Depression, grief, or cognitive decline can make personal care feel meaningless. Doctors see this not as neglect, but as a red flag. Think of it this way. When someone gives up bathing, it's often because life itself has started to feel heavier. That's why restoring a simple bathing routine can be one of the most powerful ways to restore self-respect and a sense of control. If daily showers feel impossible, there are many safe and manageable alternatives. Create a safe environment. Install grab bars, use non-slip mats, and consider a shower chair. Simplify products. Mild cleansers and gentle soaps prevent skin irritation. Try sponge baths. If full showers are tiring, use warm water and a washcloth or no-rinse wipes on key areas. Underarms, groin, feet. Set a routine. Even bathing every other day helps keep skin healthy. Consistency matters more than perfection. Ask for help if needed. Caregivers, visiting nurses, or even family members can support hygiene without compromising dignity. Bathing isn't just about being clean. It's about health, confidence, and dignity. Doctors can instantly tell when this habit has been neglected, and often, it's a clue that someone is struggling silently. Whether it's installing safety aids, using sponge baths, or finding gentle routines, don't let fear or fatigue steal this part of self-care. A few minutes of cleansing can protect your body, lift your spirits, and keep you connected to the world. Now, here's something crucial to understand. When a doctor notices poor hygiene, they don't see it as laziness, failure, or personal weakness. They see it as a clue, a red flag that something deeper may be going on. Hygiene mistakes are not isolated accidents. They often point to underlying medical, physical, or emotional struggles. To a trained eye, oral problems, neglected skin, unkempt hair, or dirty nails aren't just cosmetic issues. They're silent signals that the body, the mind, or daily routines are under strain. Imagine this. During a single exam, your doctor notices bad breath, dry flaky skin, and long untrimmed nails. On the surface, these may seem minor, but together, they may suggest difficulty with hand dexterity, early arthritis, fatigue, or even memory problems. They might also reflect depression, loneliness, or loss of motivation. This is why doctors are trained to connect the dots. Multiple hygiene lapses tell a story about independence, resilience, and health trajectory. In geriatric medicine, there's even a term for this: self-neglect. According to medical literature, PMC, and other studies, self-neglect is one of the most common situations leading to hospitalization or loss of independence in older adults. It often involves